Data management and clinical informatics. This is an area where nurses often do not have as much exposure to the actual background part of informatics or information technology. So this is just to give you an overview of this. You could have an entire course on this subject, but just to kind of hit some of the highlights that are pretty important to know beyond just knowing specific information systems that you may use in the clinical setting. So for those that go into informatics or want to have more knowledge related to this, these are some of the key definitions that are discussed in your textbook and are important to know more about if you're going to move forward into an informatics role. You hear people talk about business intelligence. That means having data that gives you ability to make good decisions about business. Clinical decision support systems. These are dealing with the ability within the clinical information system to have alerts and things that are set up that allow you to make decisions quickly, to trend data, to perhaps even be preset to alert you to changes in conditions, different things that really just help support decision making of all clinicians, not just one department or even medical personnel only, but all departments. You may hear the term clinical information system. So just realizing in a hospital, we often use an information system that is focused on inputting data related to the patient, whether that be radiology reports or x-ray photos, down to lab results or nursing assessments or other disciplines documentation. And so these are things that deal with the clinical care and condition of the patient, whereas you have a larger healthcare information system that can encompass the business components, information that's being pulled in terms of assessment data over into other parts of the information system that would be used for billing purposes and research and all different mechanisms. You do hear the term data warehouse. This really is kind of like an area within your information system where data is backed up on a regular basis and stored for indefinitely, and so it is a wonderful source if someone is looking at research. They can actually gain access in many hospitals through setting up a research study to be able to go back and do what we call retroactive data analysis on patient care, different kinds of things that you might want to compare within a big data set to evaluate a certain process or a certain clinical condition. And thus you get into effectiveness research that we've already discussed in class. You know, how well are we doing on different things as an organization to manage specific clinical conditions, to manage patient satisfaction, all different kinds of things that can be pulled from your data system. Health information exchange is an important concept in terms of having a predetermined ways that information within your health system is going to be shared with external vendors, whether that be the federal government, whether that be physician practices that are off-site or in different locations. And just having it set up to where information is two-way is very important. You also will hear the term interoperability, And this is really a key component that we've worked on in healthcare for probably the last 10 to 15 years. That is one of the reasons that you've seen a lot of hospital systems pick up and select to use Epic, which is one of the common information systems that you all have been exposed to. It's because it already has interoperability built into it so that, the lab talks to nursing has ways to see lab results easily. When you go back in time, every different department had a different type of information system, and then those were all networked together, and sometimes information could only be shared upward into a central information system, but yet it was not two-way where the people could see what you were putting in, or that they couldn't pull data to identify something they needed in their department from other things that had been put in by different departments. So the whole idea of a lot of people upgrading is to be able to get to what they call meaningful use, that there's a slide about here in a minute to discuss. But interoperability is very, very important, and historically we have not had interoperability in hospital settings. Other different things is just, you hear people talk about management information systems, health information management. You used to hear people talk about medical records. Now the term for that department is health information management, because they do so much more than just store data. They are there to manage data, ensure that data definitions are accurate, to make sure that systems are backed up and managed properly and are coordinated with other sites. So it's a much broader definition over the last 15 years than what it ever was in the past. Then you also have things like biomedical technicians that deal with technology that is interfaced or via Wi-Fi or different methods is connected to the larger healthcare information system. Clinical informatics is a field that deals with how to build these systems from a clinical standpoint so that they're worthwhile and useful for us in practice. And then there are other roles like someone who is a data analysis, and then there's actually a role for a nursing informaticist, which we're going to discuss as well. So what kind of data does nursing need? Obviously, we need data related to our clients. That is where we spend probably the largest bulk of our time. As nurse leaders, we need that information as well, because we may get a complaint, we may get, an RL6, we may just need to be researching a specific standard of care. So we need to be able to have access to client care data to evaluate the quality of care. We also, as nurse leaders, want to make sure that that the way that care is being administered overall is working well and is meeting the needs of the organization over the long haul. That can also be dependent on financial markers and different things that a nurse leader is accountable for, both within the clinical information system, but in other aspects of other information system segments that they may need to pull data, budgeting information as well. There's also the need for nursing data to really evaluate provider competencies and staffing. Many of you will go to work in an area where there's an information system where you input your schedule. And on the flip side of that, you're seeing what you put in. You may see other people that are working, but on the nurse manager side, they are able to look at what levels of staff have signed up, how many different people do we have on different days. Is there a good mix of the right providers working with the right levels of competency, as well as what's the cost effectiveness if I'm working somebody in overtime that I could switch a different day, and so I might be able to have some cost savings, however I manage that on the view that I'm looking at as the leader. And then nursing also needs knowledge-based research for evidence-based practice, which we've talked about, as well as outcomes research on overall, how is a particular service line that I'm responsible for doing as a whole. So on that thought, in terms of health services research, obviously we want to see practice-based evidence. We want to see evidence-based practice. So you're thinking, that sounds like an acronym in itself backwards, but there's different parts of, what evidence is coming out of practitioner care, as well as what kind of evidence can we glean from doing research from the data in our repository. And you see the term clinical data repository, and you can see this on the picture on your right. This is kind of talking about the medical information data repository, and these are all the different kinds of components that can make up a huge database that's going to be used for all types of data collection, data mining, looking at, do you have the right definitions in your data, which is called your metadata. But those are just how in depth some of this information can be. So what does a nurse informaticist do? The American Nurses Association first identified this or recognized this as a specialty in 1992. It is currently expected that a specialist in this area would have a master's level degree. There are many programs that you can take courses towards this to get your master's degree as an informaticist. And the focus of informatics practice is really viewing the relationship between data, information, knowledge, and wisdom sort of as a continuum, so that the right data is being set up to go in so that you can then utilize that for outcomes research on the back side of that and improve knowledge for the discipline of nursing, as well as part of a collaborative team that's doing that for clinical decision making. Their role, again, then participates in the analysis, design, and implementation of information and communication systems. They provide or facilitate education to the nurses in an agency about changes or a new information system, sometimes new technology that's going to be connected to the information system. And they also help participate or conduct effectiveness research through their knowledge of how and what data is manageable through the system or obtainable through the system. This is a slide that just kind of lays out several of the key points about meaningful use, which is a level of quality that you have attained in your information system. And the hospitals are now reimbursed better if they have demonstrated meaningful use, meaning that the data is really there and can be utilized properly by all the clinicians involved. And these are just some examples of how you would ensure that you really have meaningful use in a hospital setting. These are just a few of the emerging technologies, genetics and genomics, less invasive types of surgery that we're seeing, or computer-assisted type surgeries that help cut down on infection through using technology. 3D printing, they're beginning to do that with tissues. There are actually nurse robotics that are being used, and then biometrics is a new technology. Last of all, these are just a few of the current issues that are going on in healthcare related to informatics.